Hi, it's Christina with the Sisyphean Journal. Today is August 1st, and I don't have an anniversary, so I'm going to continue to share the joy that was Kermit Baron Gosnell. Again, I'm going to read directly from the grand jury report, and what we are going to look at now is the event that blew the lid off it, which was not Karnamaya Mangar's death, which was not Shamika Shaw's death, which is not, clear evidence that he was aborting babies way past viability. It was a drug raid. So let's go through the grand jury report on that raid, shall we? On February 18th, 2010, the Federal Bureau of Investigation and detectives from the Philadelphia District Attorney's Office executed search warrants at the Women's Medical Society, a clinic operated by Dr. Kermit Baron Gosnell at 3801-05 Lancaster Avenue in Philadelphia. Typically, we just refer to it as 3801 Lancaster. This Federal Drug Enforcement Administration, the DEA, the Philadelphia Police Department, and the District Attorney's Dangerous Drug Offender Unit had been investigating Gosnell and his clinic for months based on reports of illegal prescription drug activity. During the anti-trafficking investigation, District Attorney's Detective James Wood learned from one of the clinic employees that a woman had died in November 2009 following an abortion procedure. As Karnamaya Mangar, I'll link to her story below. Detective Wood discovered other disturbing details about Gosnell's medical practice. The premises were dirty and unsanitary. Gosnell routinely relied on unlicensed and untrained staff to treat patients, conduct medical tests, and administer medications without supervision. Even more alarmingly, Gosnell instructed unlicensed workers to sedate patients with dangerous drugs in his absence. Based on this information, Detective Wood believed that further investigation of the woman's death the previous November was warranted. The detective searched for a police report on the incident, but finding none, he went to the Philadelphia Medical Examiner's office to try to identify the woman and find out more about her death. Detective Wood learned that the dead woman was Karnamaya Mangar, and that her toxicology report revealed an extremely high level of Demerol, a drug Gosnell used at the clinic to anesthetize patients. In light of this suspicious death and other significant health and medical concerns, DEA agent Stephen Daugherty invited personnel from the Pennsylvania Department of State, which regulates doctors in the practice of medicine, and the Pennsylvania Department of Health, which regulates healthcare facilities, to accompany law enforcement officers on the February 18th raid. No one from these agencies had visited the clinic in more than 15 years, even after the Department of Health had been informed about Mrs. Mangar's death months earlier. The search team waited outside until Gosnell finally arrived at the clinic at about 8:30 p.m. When team members entered the clinic, they were appalled, describing it to the grand jury as filthy, deplorable, disgusting, very unsanitary, very outdated, horrendous, and by far the worst that these experienced investigators had ever encountered. There was blood on the floor. A stench of urine filled the air. A flea-infested cat was wandering through the facility, and there were cat feces on the stairs. Semi-conscious women scheduled for abortions were moaning in the waiting room or the recovery room, where they sat on dirty recliners covered with blood-stained blankets. All of the women had been sedated by unlicensed staff long before Gosnell arrived at the clinic, and staff members could not accurately state what medications or dosages they had administered to the waiting patients. Many of the medications in inventory were past their expiration dates. Investigators found the clinic grossly unsuitable as a surgical facility. That is a massive understatement. It was grossly unsuitable as a bus station bathroom. The two surgical procedure rooms were filthy and unsanitary. Agent Daugherty described them as resembling a bad gas station restroom. Instruments were not sterile. Equipment was rusty and outdated. Oxygen equipment was covered with dust and had not been inspected. The same corroded suction tubing used for abortions was the only tubing available for oral airways if assistance for breathing was needed. There was no functioning resuscitation or even monitoring equipment except for a single blood pressure cuff in the recovery room. Ambulances were summoned to pick up the waiting patients, but just as on the night Mrs. Mangar died 3 months earlier, no one, not even Gosnell, knew where the keys were to the emergency exit. Emergency personnel had to use bolt cutters to remove the lock. They discovered they could not maneuver stretchers through the building's narrow hallways to reach the patients, just as emergency personnel had been obstructed from reaching Mrs. Mongar. The search team discovered fetal remains haphazardly stored throughout the clinic, in bags, milk jugs, orange juice cartons, even cat food containers. Some fetal remains were in a refrigerator, others were frozen. Gosnell admitted to Detective Wood that at least 10 to 20% of the fetuses were probably older than 24 weeks in gestation. That's past viability, even though Pennsylvania law prohibits abortions after 24 weeks. In some instances, surgical incisions have been made at the base of the fetal skulls. The investigators found a row of jars containing just the severed feet of fetuses. In the basement, they discovered medical waste piled high. The intact 19-week fetus delivered by Mrs. Mongar 3 months earlier was in a freezer. In all, the remains of 45 fetuses were recovered at the clinic that evening and turned over to the Philadelphia medical examiner, who confirmed that at least 2 of them, and probably 3, had been viable. A simultaneous search of Gosnell's house found patient files he had taken from the clinic. In a filing cabinet in his 12-year-old daughter's closet, they found $240,000 in cash and a gun. On February 22, 2010, the Pennsylvania Board of Medicine suspended Gosnell's medical license, citing an immediate and clear danger to the public health and safety. On March 12th, the State Department of Health filed papers to begin the process of shutting down the clinic. The Philadelphia District Attorney submitted this case, the Gosnell death and destruction case, pertaining to criminal wrongdoing at Gosnell's clinic to the grand jury on May 4th, 2010. We, the jurors, have reviewed thousands of pieces of evidence and heard testimony from 58 witnesses. The squalid spectacle that greeted investigators when they raided the clinic last February was awful, to say the least. Yet even their descriptions of the scene could not prepare the grand jury for the shocking things we have since learned about Gosnell, his medical practice, and the way abortion clinics are regulated in Pennsylvania.